We are team number 5 and we are doing selective serotonin reuptake inhibitors. Our team members are Bin, Lisa, Randall, Shireen, Kristen, and Pamela. Selective serotonin reuptake inhibitors are commonly used to treat major depression, anxiety, and other mental disorders. It's usually the first type of treatment prescribed for depression. The exact mechanism is still uncertain, except that it prevents the reuptake of serotonin in the presynaptic vesicles in the brain. This prolongs the action of serotonin in the brain. SSRIs have the power to mildly influence mood, outlook, and behavior. Some of the common drugs in this class are fluoxetine, paroxetine, sertraline, fluvoxamine.
Some indications for SSRIs are depression, borderline personality disorder, obsessive compulsive disorder, panic disorder, post-traumatic stress disorder, premenstrual syndrome, general anxiety disorder, social anxiety disorder.
Depression is mediated by a number of neurotransmitters. These neurotransmitters are serotonin, norepinephrine, and dopamine. Neurotransmitter is released from the cellular vesicles at the terminal end of the presynaptic neuron into the synapse. The neurotransmitter usually binds the neurotransmitter's receptor on the postsynaptic neuron. However, in depression, the amount of neurotransmitter is really low. Antidepressant drugs must increase the amount of neurotransmitter in the synaptic cleft or decrease its degradation.
The mechanism of action of SSRIs is basically that it inhibits serotonin reuptake by the CNS. This causes a serotonergic neuronal transmission. It also causes an increase in the concentration of serotonin at the synapse. SSRIs inhibits hepatic isoenzyme cytochrome P450, which is important in the oxidation of many drugs.
SSRI drug targets. Depression is associated with reduced levels of 5-HT monoamines in the brain. The selective 5-HT reuptake inhibitors, the SSRIs, maintain the level of 5-HT in the synaptic cleft by binding at the 5-HT uptake transporter, which is a G-coupled receptor protein, preventing the reuptake and subsequent degradation of 5-HT. This reuptake blockade leads to the accumulation of 5-HT in the synaptic cleft, and the concentration of 5-HT returns to within normal range. The action of SSRI is thought to contribute to the elevation of symptoms of depression. SSRIs are selective in terms of affecting the neuronal uptake pump for serotonin. This action affects a multitude of specific postsynaptic serotonin receptors. So you have agonists and antagonists. Under the agonists, you have 5-HT1A, 5-HT1B, 5-HT1D, 5-HT2, and 5-HT4. Under the antagonists, you have 5-HT2A, 2C, 5-HT3.
Here is the overall big picture of what we were discussing. As you can see, the 5-HT receptor and the 5-HT, which is also called serotonin. You see the vesicles in the presynaptic nerve with that contains serotonin, and then its release. And SSRIs, they inhibit the serotonin reuptake transporter on the presynaptic nerve. So there's increase in the 5-HT at the synapse, and that could be used to cause a biological response.
Some of the adverse side effects for SSRIs are gastrointestinal discomfort, nausea, diarrhea, tremor, insomnia, headache, sedation, weight gain. Those who are cautioned in order to take the medication is renal dysfunction, hypertension, pregnancy, seizure, and diabetes. For instance, fluoxetine decreases blood sugar, which causes hypoglycemia. Black box warning detailing the risks of suicides in children and young adults. Patients on initial therapy should be observed carefully for signs of clinical worsening or suicidal thoughts or unusual change in behavior, particularly in the first few months of starting therapy or at the time of dose change.
Now we're going to talk about the drug interactions. There's going to be drug-drug interaction with other drugs metabolized by cytochrome P450 system. And just to state like how big of an impact this is, isoenzyme CYP2D6 and CYP3A4 are involved in the metabolism of more than 80% of marketed drugs. So there's going to be a high chance that if you're taking another medication, it might interact. And therefore, you want to titrate SSRI doses if you're taking another medication just to see if there are any drug-drug interactions.
For instance, in some drug-drug interactions with SSRI, for fluoxetine and its metabolite norfluoxetine are inhibitors of cytochrome 3A4 family. Fluvoxamine is an inhibitor of cytochrome 3A4, cytochrome 1A2, and the cytochrome 2C family class. So basically, example that those two SSRI interact with is
In summary, SSRI stands for Selective Serotonin Reuptake Inhibitor. The drugs in this class, including Prozac, Paxil, Zoloft, Selective, and Lexapro. The indications are major depression, anxiety, mental. The mechanism of SSRI is inhibit serotonin reuptake which increase serotonin level at the synapse, and it also inhibit P450 oxidation. The drug target is 5-HT. The adverse effect is nausea, vomiting, diarrhea, insomnia, and sedation. In this
Here are references. And thank you for listening to Team 5 presentation.